Assalamu alaikum, dear viewers. Thank you so much for watching my lectures on regular basis. This is me, Zahur Islam. So today I will teach you about the anti-tubercular drugs nursing implications. As in previous lecture, we have already talked about the different anti-tubercular drugs which are used in the treatment of tuberculosis, and then its management protocol and clinical manifestation and many more. Today the topic which I am going to present, that is the nursing implications, the role of the nurse in anti-tubercular drugs. Thoroughly the medical history and physical assessments. First of all, you will have to perform the liver function studies and the patient who are to receive isoniazids or rifampicin, especially in elderly patients or those who use alcohol daily. Assess for the contraindication to the various drugs, condition for cautious use and potential drug-drug interactions. Another thing in anti-tubercular drugs nursing implications, you will have to monitor for therapeutic effects, that either the symptoms of tuberculosis is decreased with the use of these agents such as cough and fever. CNS and CXR should be confirmed clinical finding and observed for the lack of clinical response to the therapy, indicating the possible drug resistance. We should also monitor the adverse drug reaction and adverse effects which are reported after administration of these agents, so instruct the patient on the ADR that should be reported to the physicians immediately, so that may be in the form of fatigue, nausea, vomiting, numbness and tingling of the extremities, fever, loss of appetite, depression and jaundice. Anti-tubercular drugs patient education, so this is also one of the critical. So patient education, this is critical. Therapy may last for up to 24 months, which I have already discussed. Normal treatment, that is first line therapy and second line therapy for 6 months and then 2 months, so that overall course is 8 months. But it may last for up to 24 months. Take medication exactly as ordered, the same time every day, and emphasize the importance of strict adherence to regime for improvement of conditions or cures. Remind the patient that they are contagious during the initial period of their illness, and instruct in proper hygiene and prevention of the spread and infected droplets. Emphasize to patient and take care of themselves, including the adequate nutrition and rest. Now come toward the anti-tubercular drug patient education. So patients shouldn't consume alcohol or take other medication, including over-the-counter drug. Check with your physicians. Isoniazids, so INH and rifampicins cause oral contraceptives to become ineffective. Another form of birth control will be needed. Patients who are taking rifampicin should be told that their urine, stool, saliva, sputum, sweat or tears may become reddish orange. Even contact lenses may be stained. Pyridoxine vitamin B6 may be needed to combat neurological adverse effects associated with isoniazid therapy. Oral preparations may be given with meal to reduce the gastrointestinal upset, even though recommendations are to take them 1 hour before or 2 hours after meals. So this is very easy to understand that before starting the drug therapy, this is the responsibility, this is the core responsibility of the nurse to monitor all these parameters in the form of, we should check the therapeutic effect of their drugs, and especially the organs which are related with the TBR, especially as we have already discussed that during tuberculosis your lungs are infected, and rather than lungs other organs may be infected. So first of all you will have to check and monitor all these organs which can be damaged or which are infected. So then these drugs should be used with precaution. So you should educate the patient regarding the use of these anti-tubercular drugs against tuberculosis. So you should monitor for therapeutic effect, monitor for adverse effects, and all these vice versa which I have already explained in detail.